And now I should be good now, right? Am I appearing? Yeah? Okay, that's great. So let's start. Right. So welcome everyone to the info day of the project Prescribing Culture at the National Museum of Natural History and Science, University of Lisbon. My name is Marta Lourenço and I am the director of the museum, and I am surrounded by our guests, our partners in the project, whom I will introduce in a minute. What we will do is a program until lunchtime, more or less, that will introduce this project and the partners, what has been done so far, and what we want to do next. But first, I want to address the elephant in the room, the question in our minds. Why a project on well-being in our museum? Why does it matter? We already have so much to do. We already have so few resources. Why bother? I think it matters a lot. In my view, today, there are two major exogenous challenges resulting directly from social and civil concerns that challenge museum practice, mission, and even the existence of museums. One is decolonization, which our museum has been addressing for some years now, and the other is our role in healthcare, particularly mental issues and well-being. Mental health and well-being concern us all as citizens. We all know friends or family affected by stress, anxiety, burnout, social isolation. Ourselves, we have felt it at times, perhaps even many times. In our busy urban day lives, full of stress, noise, poor working conditions, economic uncertainty, concerns about our children, our families, our friends, or concerns about the future of societies and our planet. We know mental health issues are growing worldwide. We also know that people facing any type of discrimination, race, ethnicity, gender, age, and so on, are more exposed. Women are more vulnerable than men. The poor are more vulnerable than the wealthy. The elderly, people of color, people with pre-existing disabilities, the excluded, have more mental issues, mental health problems. The more unequal the society, the more mental health issues it has. That is why addressing the issue of mental health necessarily means addressing the issue of inclusion. This project, Prescribing Culture at MUHNAC, is part of our strategic objective of inclusion. Citizens have always used cultural spaces, museums, galleries, botanical gardens, etc., as a refuge from the stress and anxieties of daily life. In museums, people can find silence, contemplation, tranquility, peace, quietness. They know that in museums they can travel through beauty, through knowledge, memory, space and time, and no questions will be asked. Museums are safe spaces. However, this dimension, this impact of our mission is hardly ever explicitly considered. Certainly, we do care for the well-being of visitors, but traditionally, we do not think of museums as potential actors, active players in the health sector. This is a different matter altogether. It requires a major shift in our values, attitudes, programs, partners, and even training. It was COVID-19 that considerably raised our awareness. The interesting part is that healthcare systems around the world, and starting with the World Health Organization are increasingly recognizing that art, culture, museums can enhance person-centered approaches to addressing health, well-being, and mental health problems. And here are some examples. Cristiano, I took a photo from you. So the healthcare systems are thinking about this also in other countries. So there's a bit of literature. So museums were not so concerned. Healthcare were thinking already about it. So it's as if two worlds apart are finally ready to meet with, I believe, extraordinarily important mid to long-term potential impacts. And now more to the point. In Portugal, our museums want to play a leading role in bridging these two worlds, the world of healthcare and the world of culture, in a more regular and permanent way. So our aims are, we want to further integrate and embed culture in traditional healthcare. We want to raise awareness, actively contribute, understand, and at a later stage, start training museum professionals and healthcare workers. We want all museums in our country to realize they can be players and start opening up, designing specific programs, establishing partnerships, collecting data, and developing research. We want doctors, psychologists, social workers to realize museums and botanic gardens are natural partners, along with others in the cultural sector, to address health, well-being, and mental health problems and start prescribing us. We want researchers from across the academy to consider the intersection of museums and healthcare as an interesting, theoretical, and applied research subject. Ultimately, we want museums, galleries, and botanic gardens to be included in national health policies. Sure, there's a long way to go. Sure, we are only beginning. But there is already a lot of research being done, not necessarily in Portugal, but also in Portugal. There is a lot of practice too, as we will see in a minute from our partners. And it certainly helps that we are a university museum where culture, but also research and teaching are an integral part of our DNA. It helps that we have incredible diverse heritage, from the arts to the sciences, from history to architecture. We have collections of just about everything, from fossils to photography, from scientific instruments to butterflies, from sounds to ethnographic artifacts and books and drawings, to botanic gardens, to astronomical observatories, to incredible spaces and objects to contemplate, learn from, and escape to. It also helps that the University of Lisbon has just appointed a pro-rector for well-being, Professor Maria José Chambel. She already has inspiring and concrete ideas, and we start working with her next week. But more importantly, we are not alone. In the last months, we have mobilized a terrific consortium, and I have now the pleasure to introduce you the Universidade Nova de Lisboa, the University of Edinburgh, Edinburgh Museums, with the program Prescribing Culture, the Santa Casa da Misericórdia de Lisboa, and the Unidades de Saúde Familiar from Baixa and Almirante Reis. They are here today, all of them. Thank you so much for being here. Just to conclude, what did we do together these months? We now have a cultural infrastructure which comprises the museum, the Jardim Botânico de Lisboa, the Jardim Botânico Tropical, the Museu de São Roque, and the museums, of course, not in Lisbon, the museums of the University of Edinburgh. And with our partners, we're going to target the following audiences: students from the University of Lisbon and from the Nova University of Lisbon, senior citizens with the help of Santa Casa da Misericórdia de Lisboa, and people in social isolation, poverty, and situation of exclusion through the Unidades de Saúde Familiar. So I have the pleasure to introduce you, and now I stop sharing. I have the enormous pleasure to introduce you Ruthanne Baxter from the Museums of the University of Edinburgh, who will speak first. Then Cristiano Figueiredo, Mariana Oliveira, and their team. There's more people here. I don't have their full names. Welcome all. They will speak on behalf of the Unidade de Saúde Familiar Baixa, Almirante, Reis. Edith Oliveira from Nova. Margarida, Montenegro, Etelvina, Ferreira, and Fernando Martins?
Pinto.
É isso. Fernando Pinto from Santa, and others from the team from Santa Casa da Misericórdia de Lisboa. So here we are, and I would pass now immediately to Ruthanne Baxter. Welcome.
Thank you very much.
The floor is yours.
Good morning, everybody. I will just get this to slideshow. Okay, can everybody see this? Yes, fantastic. Okay, so I am the museums manager at the University of Edinburgh and the Prescribed Culture lead. So Prescribed Culture is ultimately the University Museum's flagship heritage-based non-clinical support for health, well-being and social care. And it actually got going before the COVID. We had the steering group set up in 2018. And the steering group had a very interdisciplinary selection of people, including the university's director of student wellbeing. We had a lead GP from the university's health centre, and we had support from social prescribing link worker managers in Edinburgh City, and we had representation from the students themselves. So it was initially set up specifically for the university community. And it was instigated because the one of the reports for the 2017-18 academic year had stated that the need for the university's counselling service had gone up by 22% in one academic year. There were lots of reasons for that. Actually, in some ways, a good thing, because people are becoming a little bit more open to expressing having challenges with their mental health. Some students coming from new backgrounds, if you like, into the university, who come with already pre-existing conditions, etc. So lots of reasons, but ultimately a lot of pressure on our colleagues in the health service and the counselling services of the university. But then COVID kicked in, and we made the offer available to really anyone out in the public and in the internal community who were seeking support for mental well-being. So on the screen are the four offers available. Two of them are available right now and consistently on a weekly basis, and two of them are, one's in a pilot phase and one is coming back in person, hopefully, from February 2022. So just really quickly, Take 30 Together Virtual, that is, the tagline is escape, explore and e-socialise with the World of Heritage. And that happens every Wednesday lunchtime. It has an intergenerational, international mix of members, and we use very much, you are a Prescribed Culture member. And that, as I say, takes you to different parts of the world, but it is self-referral. So ultimately, anyone over 18, anywhere in the world, who registers for the programme via the registration form on the website can take advantage and benefit from that. Programme 6 is part of the original pilot, and that was paused due to COVID because it takes place in person, in small groups on cultural sites. But that's the one that we're bringing back into place in February. And the pilot was for student only. In the next reiteration, it's going to be open to students and the local population of Edinburgh City. So it will be a sort of what would be called a town and gown mix. So that is 6 weeks of 90-minute sessions, which really take the first 20 minutes exploring and looking at the stories behind an object or an archive, then 10 or 15 minutes of tea, coffee and chat, which is the essential social prescribing bit, And then a very relaxing hands-on activity, which can be anything from bookbinding, scrapbooking, street photography, etc. Unlock and Revive is our online cultural events for the dementia community. And this is sort of, if you like, put out there via community care partners. So the registration is done by people who are in charge of maybe local dementia hubs, people who are activity coordinators in care homes. So that goes out again. It's a 10-week program seasonally. So we did a summer one, we're in the middle of the sort of winter one, and we're planning towards the spring one just now. And that happens for about 40 minutes every Wednesday morning. And finally, At Home with Heritage is our non-digital one that goes out. It's a postal service that is in pilot on a monthly basis. The participants there are aged everything from a 14-year-old who has autism to an 86-year-old who has dementia. So it's a very wide-ranging participation profile, and they get boxes with some heritage-inspired themes, and the themes for December are food and drink, and we are sending out the boxes next week. And they're just full of little bits of information, but mostly hands-on activities and conversation starters to just help people who are mostly housebound to stay connected and active. And really, for all of our programs, we're trying to make people feel connected to the world around them and or others, helping them to relax and chill out a little, or indeed, on the flip side, make them feel alive and part of something bigger, and energize them and give them a sense of purpose. And I'll come to that bit in a little minute. So the big epic lessons learned so far for me are educate and evidence, partner up and persevere, I for the individual, and context and compassion. So I'll take you through those very, very quickly. Education, just what Marta was saying, training is absolutely essential. In the cultural sector, you don't just go into this without any training or understanding of the sort of topics you might be coming on to. There's lots of, Marta did say that there is a need, I think there is a need for strong, robust evidence of the powerful benefit impact of heritage-based cultural prescriptions, but there are evaluation tools out there, and there's not really one that's absolutely perfect, but there are tools out there, and please use them in your cultural prescription or social prescribing offer, because again, it's all about building the evidence and building the research. Partnering up and persevering, that can be both intersectoral. So it's really important, as I said, I have worked with a GP, I have worked with a link worker, we have a social, we've actually got a link in with the School of Social Work. So you have to get to know and understand the world of others, but also to make things maybe a little bit easier on yourselves, you can partner up with other cultural organisations. So one of the things that we do here is we work very closely with Historic Environment Scotland. So they take on delivery of some sessions. So it isn't always the University of Edinburgh Museum staff who are having to deliver on a weekly basis, but as a collective, we can provide something to our prescribed culture members on a weekly basis. So partnership is absolutely vital. And what I will say is it is a slow burner. When taking as an example, the Take 30 Together virtual program, when that first went up in May 2020, we regularly for months had a maximum of 8 to 9 people attending. And now that sits regularly at 27 to 30, but it literally took a year to get it to that level. And to be honest, any more than 30 people, it starts changing its dynamic. So for me, heritage social prescribing and cultural prescriptions is quite small group, even at its best, and actually possibly at its best being small group. The I, as I say, we're all about personalised care in the health and social care sector, and I think that that must be reflected in the cultural offer as well. It's the individualist centre. They've been asked, we're hearing more and more that enlightened GPs sort of don't say what's the matter with you, but what matters to you. So they're possibly coming, having explored that, and they know what matters to them. And then we have to be honest about, can we help you? And we need to just be very clear about what our offer is, and it might not be appropriate for many people, but hopefully it will be appropriate, and we will chime with a significant number of people. And when I said earlier about the link between Take 30 Together and Unlock and Revive, we are now at a place with Prescribed Culture where we have what I'm calling the Prescribed Culture pathway, and it moves people who have come on board as users, as people who were in need of support for their mental well-being and social connection. And now they have, if you like, graduated, to use university speak, to being assets, and they now deliver on the Unlock and Revive program, and also deliver some sessions in the Take 30 Together virtual. So they are what I'm calling citizen heritage social prescribers, and they get the additional benefits of that sense of purpose and bringing meaning into what they're doing. And admittedly, a number of those people have been people who have recently retired. So they went into retirement, and as can quite often be the case, they just felt a little bit lost, and all of a sudden didn't quite know what their purpose was. And this has sort of given them a little anchor. And finally, context and compassion. So I'm very aware that in Scotland, I know that in the UK, there is, I think the stat was for every psychiatrist in the UK, they're serving a population of 12,000 people. There are 800 GPs vacancies. So it's really important that if the cultural sector intend to do this really well and effectively, they must get in and understand the context that the health and social care sectors are working in, and get to know, have a coffee with somebody who is a social worker, who is a link worker. If the GP has the time, a quick 20 minutes with the GP, and understand what their day-to-day looks like, because that, I think, is really important to doing this well. And compassion. Have compassion for the individuals and the participants that you'll be working with, compassion for all your partners, and especially also compassion for yourself. So those would be my biggest sort of lessons learned so far on the Prescribed Culture journey. And just if there's time, and I hope there is time, sorry, the sun is coming in at me, and oh, there it is, I couldn't see my thing. So this is just a quick story of one of our users to assets. So Paula is one of our students who is from Spain, and because of COVID, unfortunately, Paula has got a parent who has got mental health difficulties, and she needed to go back to Spain to be with her parents during that situation. She herself has her own difficulties, and alongside therapy, Paula joined Take 30 Together Virtual and really got an awful lot out of it. And one of the things she does now is I call her our European scout. So she goes and sort of susses out museums and heritage sites on mainland Europe that might be really interesting to visit and be a destination as part of the Take 30 Together Virtual. And again, she's doing that in what is her leisure time, but it keeps her stimulated, and it keeps her very much connected to being active in the heritage sector while she's been in having difficulties in other ways, and it has really, really supported her. So that's just a little individual case study. So that's me. You can get me on Twitter, you can get me by email, and I am really excited about working in partnership with Marta and Raquel and Edith and the whole team in Portugal.
Well, thank you so much. And Ruthanne, I must say, I forgot to say, but you are really the godmother of this project, because you started everything, you put us in touch. You, in that conference of the University Museums in Scotland, I saw you, and, you were so kind and immediately very engaging and very enthusiastic and inspiring. So you put us in touch with Cristiano and everyone. So really, thank you so much from the heart, Ruthanne.
No, thank you very much.
You're welcome. So now we go on to Cristiano Figueiredo. He's a doctor. He's going to speak in English too, as a courtesy to our Scottish guest. and he is a fantastic, probably one of the few people really concerned in Portugal. Is actually studying, doing research, really serious stuff, publishing and everything, not like you know. And so here it is. The floor is yours, Cristiano Figueiredo, please.
Thank you. Let me share somehow. Let me see, how can I do it? Sorry, presentation. Can you see it? Okay.
Está perfeito, perfeito, avança.
Okay, so I'm a GP, a family doctor based in Central Lisbon. I'm a specialist in family medicine since 2017. And in the same year, I started working with our social worker in the family health unit Baixa on introducing social prescribing in Portugal. And this has been a really challenging, but also very rewarding project. So let's start. My idea is mostly to introduce you to the idea of social prescribing in Lisbon, how it's how it started and how it works, and I will bring as well some data from museums and nature prescribing, and hopefully we can have a good discussion afterwards. So the slides are in Portuguese, but I'll speak in English, so everyone will be happy and will manage to understand. So I'm representing actually two family health units, family health unit Baixa and family health unit Almirante. They are kind of cousins. They are very close to each other, not only geographically, but also in the way the teams work. So we are both health centers with a very young team, young GPs, young family doctors who accepted the challenge to work in central Lisbon. And that's a challenge, as you will see. We have, for example, in family health unit Baixa, we have 10 doctors, 9 nurses, and 6 clinical secretaries. And the clinic is based in Martim, probably the Big Apple, the melting pot of Lisbon. Then you have as well a picture of the family health unit professionals down there. And why social prescribing is so important in our communities. So we are serving a very multicultural and kind of unequal community in central Lisbon. Arroios is famous to be one of the parishes with most migrants in Portugal, with a lot of nationalities. And as a result, for example, in family health unit Baixa, we have 94 nationalities, and about 25% of our patients are migrants. So there is this kind of cultural exchange and also cultural pressure that our population faces. That adds to the tourism gentrification and a lot of developments in the last years. And maybe explaining a good way to see how is our community is to see the life expectancy along the blue metro line in Lisbon. As you go from the north in for example, the zoological garden or the Sete Rios in North Lisbon, and you go down the line to Santa Maria Maior, where our family health unit is based, where our GP practice is based, you see almost 6 years gap in life expectancy. So people, as they go down the line, blue line, even though they are more central Lisbon, they live less time, and that is the consequence of social inequalities and also health inequalities. And what is curious about this is maybe most of the cultural museums, cultural hubs in Lisbon, they are located near to Santa Maria Maior, and probably the people using these museums are the people living in São Domingos de Benfica. So there is for sure a gradient, not only in life expectancy, but also in the use and access to museums, even though the people in Santa Maria Maior live next to a lot of theaters, museums, and cultural institutions. So this was kind of the idea. This was kind of the motivation to start social prescribing in Lisbon as a kind of a partnership between the health sector, the social sector, the academia, universities, in a way to provide patients better well-being and better health outcomes, and thinking about health in a more holistic manner. when you speak about social prescribing, actually you are speaking about bridges, and this is the most famous bridge in Lisbon. And what happens is, in one side of the river, you have the health sector with their own population, their own needs and challenges. And in the other side of the river, you have many social partners from the social enterprises sector, and as well the culture partners. And there is a problem, there is a no communication problem between both sectors. There are not easy bridges that allow the flow of the patients between the two sides of the river. And social prescribing creates this bridge, makes a referral to a museum, to a garden, to a local association as easy as a referral to a hospital. And social prescribing is about creating relationships, easy communication pathways, and trust. So basically, you are speaking about a model of integration of care between healthcare and social sector that allows the family health units, the GP practices, to answer no medical needs of their patients. And it creates a network, a referral network between to the community that allows a holistic approach, focus in the needs of the patient, but the overall needs, not only the medical needs, but also the social needs, emotional needs, and practical needs of the patients. In particular, it allowed as well to promote the essential work of our social workers. The social workers in our family health units, they accepted to do the work of the social prescribing link worker, and that also allowed them to expand the way they were working, the activities they were offering to the patients, and to be perceived by the health team as a more valuable health resource. So you have like the health professional, the family doctor, family nurse, psychologist, identifying social needs in the consultation, and then referring the patient to a social worker who will try to understand what is the actual need of the patient, what matters conversation, and then to discuss with the patient a plan that can activate different partners at the community, the Santa Casa da Misericordia, the local parishes, local associations, and now museums, and now gardens, as we are speaking today. I think the essential pathway to raise a project like this is important to bring people together. So since the beginning, you are running meetings at the community, bringing health sector and social sector and also local authorities together in the same room to discuss about the same problems. And everyone was contributing with different visions, different resources and perspectives, and that was very, very interesting. As well, with the social prescribing movement here, the health sector started visiting local assets, community assets, and try to understand what's being offered to our patients in the community. And of course, with COVID, we needed to adapt our way to communicate to a more online perspective. So Zoom was very helpful in this, even though we couldn't continue as frequent meetings as before because of all the pressure with COVID-19 on our services. But we never stopped doing social prescribing during pandemic, never. So just give you one idea, what is the kind of patients that can be referred to social prescribing. We have Abiba, is a pregnant woman from Bangladesh, only 23 years old. She's living in Portugal for 9 months, pregnant of 20 weeks, and she's not speaking English, not speaking Portuguese. And as you imagine, the husband is working all day, is the only one working and providing for the family. And she, as a recent arrival, she doesn't have friends or family here, and she stays at home alone. And then you have Mr. Jose, 75 years, is living with wife, several chronic diseases, the neighbors were evicted, children are living far away from Lisbon because they cannot afford a house in Lisbon. He spends the day watching TV, is worried about memory, and is like low mood for several months. And then you have Paulo, a 56 years old, is unemployed for 4 months, 4th year of schooling only, and that's very common in this population. Is divorced, lives in a shared room with support from Santa Casa da Misericordia, is obese and is getting more and more anxious, not believing in himself, suffering from low self-esteem. And what do you think? Do you think this is the right solution for these patients? Should we medicalize something that is not mainly a health concern, a health disease? So right now they don't have a disease. Maybe if they continue in this situation for more months, maybe they'll get depressed, anxious, maybe dementia, and medicine only has an answer to these problems when the disease comes up. Okay, and the idea of social prescribing is offering something before the disease is there. It's true preventive medicine. So, for example, for Abiba, we can provide a mentorship program for migrants, like Portuguese courses for foreigners in a local association, maybe join a pregnancy club in the Alp. For Mr. Jose, we have, for example, a senior university, is kind of academy or a group, a community group for people older than 55 years old, where they can learn different subjects, when they can do different activities, many of them related to arts. For example, you can join a day center of Santa Casa da Misericórdia. Santa Casa is a charity, a local charity. And for example, a very new partnership is Cycling Without Age, is a partnership where older people who have problems to walk can go on a ride in a bicycle with some volunteer. For so Mr. Paulo, for example, a physical activity program, Lisbon plus 55, or maybe join a volunteering project with Santa Casa, or for example, go for the first time to a theater that is just next door, but he has never been to. So there is a national theater, maybe 500 meters from our practice, and a lot of our patients never been there. So what we are doing, we are acting on the social determinants of health. As health sector, we have to understand that our influence on healthcare, on health outcomes is very limited. Only 20% of health outcomes, well-being outcomes are related to access and good healthcare. Everything else is related to health behaviors, physical environment, and socio-economical factors. So when we start social prescribing, actually we are acting on the social determinants of health. We are crossing the gap. We are crossing the bridge to allow the health sector to be more resilient and more creative in addressing the needs of the patients. This is another bridge, okay, and maybe a few of you recognize the bridge. This is a bridge in the Botanical Garden in Lisbon, and in 2019, our health teams, Family Health Unit Baixa and Family Health Unit Almirante, they went on a walk in the Botanical Garden, and this was a nice picture to remember the moment. And when you speak about museums and nature regarding social prescribing, we have many papers coming out and different and good knowledge and guidance about how to do this. For example, this article, Art, Nature and Mental Health, Accessing the Biopsychosocial Effects of Creative Green Prescription, Museums Program and Involving Horticulture, Art Making and Collections, they say that in this research, they saw that people were feeling better. There was improved in well-being of patients, improved self-esteem, decreased social isolation, and also, very importantly, benefits to the mental health. And they say, for a conclusion, that museums and with parks and gardens, so the museum we are speaking about, should consider integrating programs of outdoor and indoor collections inspired creative activities. So that's what we are doing in Lisbon right now. And this paper about nature-based social prescribing in urban setting to improve social connectedness and mental well-being is a paper published in the US, so is not in the UK as usual. And it says, like, for example, walking, park prescriptions, community gardening, farmers market vouchers. These kind of activities can promote nature contact, strengthen social structures, improve longer-term mental and physical health, and probably is a very valuable resource for high-risk populations as moms with minors, recent migrants, older adults, economically and linguistically isolated populations, and people that usually would not go to the nature and outdoor spaces if they are not prescribed. So we have here some nice concept maps of what you should consider about museum-based programs for social isolated older adults. You should see the museum as a positive enabler, thinking about the individual journey of the patient through the museum, and always considering the relationships on the way. And for example, about nature-based activities, we have this also picture representation of what you should consider when you are prescribing a patient these kind of activities. So these are very nice pictures that maybe one day can be in Portugal. So there is an international movement about nature on prescription, culture, prescribing culture, prescribing nature, prescribing museums, and these are different solutions of social prescribing, and can really change the way we provide healthcare and the way healthcare relates to the community. In Portugal, the only social prescribing project active is in Lisbon, but many other cities are considering to implement social prescribing. Many other cities are aware of social prescribing, and probably in 1 year time, the scenario will be quite different. So I'm just finishing. In the Nova University Lisbon, you have created a research group on implementation and evaluation of social prescribing. It's called Nova Pessoa. It's based in the National School of Public Health. If you like any advice, guidance on implementation or evaluation of social prescribing projects, please write to this email, and we are very happy to try to help you. So that's it. Thank you very much.
Wow, Cristiano, it was great. I mean, we talked for hours when I visited you, but now it was all organized, the knowledge, systematic. It was fantastic, and congratulations to your work. You're absolutely great, and to all your team. And indeed, they're very young and nice, and friendly and welcoming. I felt at home when I visited you. Thank you so much. So now we move on to Santa Casa da Misericórdia, also a fabulous partner, and they will intersect. They already have, of course, being Santa Casa da Misericórdia, they're already doing a lot of work, including with Cristiano, so he mentioned it, but they intersect this project in a different way, because now we have the Museum of São Roque being a protagonist and pushing, pushing ourselves to a more cultural dimension of the social prescribing thing. So here we are. Who is going to speak first? Is it Fernando? It's Fernando. Very good. Fernando Pinto, thank you so much, and the floor is yours. Perhaps you can introduce your colleagues. I didn't ask Cristiano to do that, but I will later. But please do now, Fernando. Introduce the colleagues that are here. You are probably muted. Fernando? We cannot hear you. You are probably muted. Let's see. Yeah, he is muted.
He is muted, yeah.
Fernando. Margarida, can you send him, maybe he's on the phone or something for a short while.
Fernando.
Can you send him a...
O altifalante.
Pronto, finalmente.
Ok.
Estava aqui com uma dificuldade. Conseguem ver a tela partilhada já ou não?
Muito bem.
A apresentação está visível?
Está visível.
Ok, pronto. Então, peço desculpa por este hiato. Good morning. Thank you for the invitation, and it's nice to meet you. We are from Santa Casa. Etelvina is the leading of social welfare department, and Margarida from cultural department. We are just to share some few ideas about our institution and our work. For me, it's easier to read, so I apologize because my English is not very good. I will read short lines with some 5 ideas about our work. So, with more than 5 centuries of existence, Santa Casa da Misericórdia de Lisboa is a private institution although with public purpose and with a special link to the central government. It was created by initiative of the royal family to face the social problems of the big city of Lisbon in the time of the discoveries, but adapting to the demands of each time, Santa Casa reached our days as a reference institution where tradition coexists with innovation. The old city gave way to a city that is the center of a large metropolitan area that has the highest population concentration in the country nowadays. As you can see on our website, social action, we should say social welfare, is at the heart of Santa Casa's activity. Besides this core mission, Santa Casa's activities expanded to other areas, including health, culture, education, social entrepreneurship, as well as heritage, lotteries, awards and research, projects and funds. With the social action activities, we contribute daily to the well-being of people in the different stages of their lives, preventing situations of inequality and socioeconomic deprivation, vulnerability and social exclusion. Dealing with welfare promoting activities in close connection with the different administrative divisions of the city, there is the Department of Proximity, Development and Intervention, DIEP, in which social intervention facilities are organized. We are talking about 28 childhood support facilities, such as nurseries, kindergartens and familiar nurseries, 19 day centers, 10 home support services, 5 community centers, and some atypical social responses. We have also an education, training and certification center with 2 established units and a large offer of professional courses and activities to improve personal and social skills. At the heart of social area, personalized assistance is provided and a response aimed at individuals and families with the purpose of solving or minimizing situations of vulnerability. This intervention uses a personalized approach, although taking into consideration the communal insertion of the person. Both the facilities and the assistance are run through Proximity Development and Intervention Units, UDIP, organized according to the geographic area of influence. There are 10 UDIP. The focus of these units is the proximity to people and institutions. UDIP Colinas is the unity for the historical center, which involves a traditional downtown shopping area and some of the most popular neighborhoods, such as Moraria and Alfama. Well known as a touristic postcard, this area faces social problems that run from tourist massification, aging population, and gentrification, as Cristiano described later. Together with old problems such as poverty, drug abuse, and other items related to social exclusion. But our work is to help people and give the best support available using our own resources and also the resources of the community. And so there is a daily network with parish councils, police, and health services, among others. The USF Baixa is one of our main partners, and we are quite interested in the idea of social prescription. The first steps we took were aimed at knowing each other, presenting the teams and understanding each other's mission job. We look forward to a more concrete social prescription practice and good examples, for which we can offer our resources such as the day centers, volunteering opportunities, and also Santa Casa's cultural spaces and activities. That's what Margarida will tell you about. Margarida, posso continuar a passar?
Margarida está muted.
Já estou com o...
Ok,
Já estou.
avance.
Obrigadíssimo.
Fernando, foi
Obrigadíssimo.
fantástico. Vá, Margarida, avance, querida.
Hello, everyone. Thank you very much for the invitation. I'm the director of the Department of Culture of Santa Casa, which includes the Museum of São Roque. I will present an example of an activity in which we took the museum to senior residences of Santa Casa to combat people's isolation and keep cognitive skills active. It's just an example that we can show you.
Margarida, sorry to interrupt, but there was something with the PowerPoint which we stopped seeing. There's okay. Now back. It's good. It's good. Now it's good. Okay.
So I was telling you that this is only an example, and we could do more things together. This project that is to take the museum outside to the senior residents is a project aimed at senior citizens from the day centers of Santa Casa da Misericórdia de Lisboa. It has the object to take the São Roque Museum to people's home, to reduce isolation and to keep cognitive capacities active. Pode passar, Fernando, não se importa. Santa Casa has a senior residence that is the Faria Mantero residence, that is a residence to people that are connected with ill people, sick people, but that are connected with culture. They were painters, they were authors of texts, and so we took this activity over there. We made natural size reproductions of 4 paintings of the museums, the Museum of São Roque, which were transported by a company which used all the procedures for handling works of art. The objective is to do the things that we've done when we handling works of art. The residents made a first close look at the paintings. We give them a time to look close to the paintings. Pode passar. And then this project, this activity will include 3 phases. In one first phase, the technicians of the educational service gave an explanation of each painting and at the same time drew attention to the objects represented in them in order to make a comparison with today's life, showing them as they are today. So they have objects that are represented in that paintings, but they are used today, and they make a comparison with what is the use that we have today with these objects that is similar or not with the use in the 15th century. An example is a cloth basket. There is represented in one of the paintings. Podemos passar. The second phase is they also take to the residents a very large cube with the sides showing details from the 4 pictures. Then they roll the cubes as if they were playing dice and asked seniors to identify which picture had that detail on it. A seguir. The third phase, they also took postcards that they give to the senior people, it has two objectives. In a way, is a remembrance from the activity, but is used over there during the activity. The postcards have an image of each picture with phrases, quotes, popular proverbs on the back, and for the seniors to explain in which of the pictures that phrase or project fitted. So they keep the postcard with them, and it is at the same time a remembrance of a memory of this section. This is what we have done without being involved in this project of prescribing culture, but I think it is an activity that can be inscribed in a social prescription. This is only an example. We do more things, but I think this can be only to show what we do. We do another things with senior people of Santa Casa residents, that is a voluntary work of reading books in the senior residence. We have the Department of Culture has a library. They took a book to, they make sessions in various senior residences, and they read the book, and after the book, with an orientation of the librarian that goes over there, and with the orientation of the, como é que se diz, os animadores culturais?
The mediators, the cultural
The
mediators
of the residents, they make a discussion about the text.
Fantastic, Margarida. You are so inspiring. I mean, from the day one that we met, you've been...
Of course, we can do, now that we are in this project, we can work in other activities corresponding to the aims of this project.
Absolutely. And another point that we want very much to do with you is to gather more evidence, as Ruthanne said, you know, to be an infrastructure for research, so that we can have more data about the value, the impact of museums in mental health issues and well-being. So that's going to be...
is very important.
Very important.
Because this is a kind of physical evidence that culture has a good impact in mental health.
Exactly, exactly. So I would thank you now, Santa Casa, and I will go to our next partner. We are in a university, and we have this possibility not only to reach students, but also to train, because training, as I said, is part of our DNA, and also the research part. I think the research part is going to be a challenge, but unless we raise awareness in our communities, our three universities, there are three universities involved here, Edinburgh, Nova, and Lisbon. And so unless we raise awareness, we will not have that evidence. So let's start with the students, and I would invite now our dear colleague Edith Oliveira from Nova to present the work she's been doing with students at Nova. Thank you so much, Edith.
Thank you, and good morning. It's a pleasure to be here with you. So, contrary from Cristiano and Ruthanne, my experience is quite different, because we are at the beginning of this challenge in social prescribing. But I will share a little PowerPoint with you. So, Nova University had 9 faculties, different faculties in different years too, and we are interested in improve the well-being and mental health from students, and give them tools to deal with. So I am a Human Development Office Coordinator, so this department have programs in extracurricular activities as a volunteering program, tutoring program, and mentoring program, and is in that way that we believe that a social prescribing could be a good tool for students with mental health disabilities or some difficulties. So for this academic year, we are beginning a pilot project in social prescribing. We disseminate the project during the month of October. After that, students can do a registration in this project, and students with psychological vulnerability can request an interview. So when this happens, the interview is done by a psychologist, and the psychologist try to understand, to understand with the students what are their real needs, and direct these students for a volunteering program in social prescribing or another. For this pilot project, we involve students with relational or interpersonal difficulties, displaced students, students with depressive symptoms, and students with a low self-esteem. At this moment, we have 5 students involved in this pilot project. So for this moment, we don't have too many information or results, because they beginning in this month, so they are at the beginning. Maybe in the next semester we can have some results, but we believe that could be an important tool for them. We try to involve students in the variety of social activities, particularly in volunteering activities, because our students stay sometimes in academics activities too much time, and they don't have a good organization in terms of their personal or interpersonal life. And our goal is to sensibilize and to give them some other advices to have a good organization, a good academic life organization, and to put in practice other capacities, other personal capacities in terms of them academic and them holistic learning and personal formation. So we are at the beginning, so we knew the Ruthanne experience, and we appreciate a lot. I was opportunity to do her program, and I hope that maybe in 1 or 2 years we can put in practice something similar with our students. Yes, maybe we can develop an Erasmus project, of course, but the goal for this semester is to have some students. So at this moment we have 5 in social prescribing, and at the end of the semester to analyze the impact on a social life, an interpersonal life, and academic life from these students, and go ahead. So I'm available for questions, but in fact, for now, it's that. So we are at the beginning. Thank you.
We are all at the beginning, my darling. It's just, yeah, there's nothing we can do about that. And that's what's exciting about it also.
Yeah.
You know, they were kind of, caminho constrói-se caminhando. I don't know that cliche, but it's kind of the way that I feel. I mean, we're just, inventing, prospecting. But as I said, we're not alone, and that's fantastic. So students, seniors, we already had kind of a picture of why these partners make this complete, comprehensive photography that make us feel very inspired to engage with this project. But now I would ask Raquel Barata, who is going to, be the responsible. I mean, somebody has to, puxar a carroça, as we say. And that's Raquel. She will do that, and she's glad to do it. She's very inspired. And we hope to count also on all the museum. That's the point of this Info Day. Raquel, tell us, how are we going to get ourselves organized? What are we going to do? What's the plan? Tell us.
Okay. Good morning, everyone. I'm going to share some 6 slides. There are very few. Let me just see. Oh, can you see? Are they okay? So I'm just going to briefly describe what we've been doing until now. And when I say this is from July until now, in terms of integrating social prescribing at our museum and the Lisbon Botanic Garden in particular. So starting from the target audiences that Marta introduced, we have met the universities as partners, the Santa Casa da Misericórdia and the São Roque Museum for targeting senior people, and the health centers in downtown Lisbon to start to receive, to host prescribed volunteers. So in September, the museum we were at Nova to present our volunteer tasks in order to be a partner to receive volunteers of Nova University. So the students could come and choose, oriented by Edith, of course, could choose the Lisbon Botanic Garden or the museum to start volunteering. And we also start this month, and we're going to continue next month, meeting the University of Lisbon departments also to do the same, to present the museum and to include the museum and the Lisbon Botanic Garden and the Tropical Botanic Garden as places to prescribing culture. In terms of the senior people, we met with Santa Casa and the São Roque Museum, not only to know what they're doing, and it's amazing what they've been doing with daycare centers, and of course to have this opportunity to develop combined activities between the two museums, for instance, with the senior people, but also to have these prescribing activities, because Santa Casa also prescribes and have that role, to both the museum, this museum, the National History Museum, and the San Roque Museum. So, and with the health centers downtown Lisbon, we have a large meeting in October where I could meet all the doctors, Cristiano and Mariana, and the social workers, the Andrea, Paula, and we started to think about this process, because for us everything is new, and we start to think about this process of receiving prescribed volunteers in our museum and garden. So we did an outline that I'm going to present next about the needs for me to prepare, to have everything arranged, and they already start prescribing volunteers to the Lisbon Botanic Garden. We started with the Lisbon Botanic Garden because of the COVID situation, but of course we have also the Tropical Botanic Garden, which is the same, so we can also come to Belém. It's in different, they are in different places, or to have some tasks developed inside the museum, but later on. And of course, now the situation is going worse, so let's see. So about this, the outline of this meeting, about this cultural prescribing process, and of course for me, this is the real, for us in the museum, and this is a meeting to the museum staff and professionals. So we have to think how to do this in the right way. And I think this is the main thing worrying us. The first thing is the sending entities should be, of course, health providers. So they can prescribe this volunteering, and they can they can approve before the institutions that can host these volunteering schemes. Then the social workers in these entities, they get in contact with the link person at the hosting institution, which of course can be a museum, and sends the diagnosis profile of the volunteer, their motivations, and the contact number. Also other data required, for instance, for insurance, but we can also ask for that later. And then this link person at the museum must personally contact the volunteer, and one by one. And this thing Ruthanne was talking about, of having small groups, it's also important that before they integrate that small groups, they must be first received one by one, and book this first meeting. In this first meeting, we will create a link with the place, the possible tasks, the tutor and team, if possible, to meet them. And the idea is to book the volunteering. And in this meeting, this first meeting, we will create confidence. So this link person is responsible for following up the process of each prescribed volunteer and give feedback to the social workers. This is really important because our role here is really to provide well-being. So we must have that in mind all the time. And we have to be sure that people coming and integrating these programs, they are really feeling good. And of course, to establish volunteering schedule and book a date to start. This was the first process we could identify to start receiving the volunteers here at the museum, sending the health centers, sending them to me, and me being, for now, the link person at this museum. Of course, this is a slow process because of this need of being sure that people are really feeling good. So what was the prescribed profile that we arranged with Cristiano and Mariana that could be sent to the museum and gardens? People with anxiety, people subjected to social isolation, and this could be, as Cristiano said before, retired people, migrants, or unemployed people, or even young people, young adults with mild depression symptoms, as Edith said, for instance, at the university context. So they sent us the first volunteer, and I received her last Wednesday. It was really, really great. And just to say to you very quickly that this was good. And I just had this idea, which I discussed with also Ruthanne, that we have to be to have a profile to do this, and also to be open to everything that may happen, willing to collaborate and help all the volunteers that want to collaborate with us. So she came. She was at first very she was not sure if she could do this, because of course there are so many obstacles to overcome right now, one of them being the COVID situation that just scares most of us. But then we were for an hour talking and visiting the garden. She was very, very enthusiastic about the garden. It was a beautiful day. It was really, really great. And at the end, she said to me, yes, okay, maybe this is a good idea. So please phone to me again. And I did yesterday. So she will collaborate with us, but in March, just when this situation of the COVID pandemic and also the winter is passing by, she will be more interested maybe to be inside the museum, working directly with curators and the collection. So of course, we have also to have this motivation, this personal motivation, of course, and then personal likes of people in terms of going towards them. So thank you so much, Ruthanne, for the epic dimension of the profile for this professional development, which is for sure what we need to do in the heritage sector. What we need to have in terms of maybe skills or experience in terms of the people who is in charge of this is, of course, the experience in working with different audiences. And that's why the education offices are, they may be at first the first professional experience to look for, and also to develop these vocational skills to promote the empathy and confidence, which is really necessary for the things to go well, as you said. The skills for listening, to observing and focusing on connect to the other, being passionate, of course, all the museum professionals are, to engage, to build this capacity about the place and the collections, to be tolerant and flexible, being willing to collaborate with the volunteer, with the other, and aware of this relevance, to follow up a close contact with prescribing entities. I think this is really important, because as Cristiano showed before in this process, but now the museums are going in also, we need to keep going together for this social prescription work well. So now I think that I also felt that concerned the museum professionals could be, what are these tutor roles? The person who will be in charge of monitoring all the work of the volunteer. So I tried to, in this small experience we had, and because I was discussing all this with Ruthanne, and it is so good because I didn't saw before these epic dimensions, but everything just fits in really, really good. The tutor must list detailed tasks available to be prescribed. So they should be really detailed for doctors and social workers, explain to people what they are going to do in detail. To receive the volunteer together with the link person, of course, in the first day, in order to explain the tasks, detailed the plan, to introduce the team and establish a routine. And this routine is really important, being being whatever routine may be, weekly, monthly, whatever. To monitor the volunteer, the tasks, while promoting well-being and anticipating any risks. And then to maintain this close contact with the link person in charge to facilitate not only the follow-up and feedback to the health providers, but also to help solving any risk for well-being. So these were my fairly first, very preliminary conclusions, and of course these are for discussion with everybody now. But what are our next steps in terms of continuing this project? To continue the collaboration with partners, of course, in order to develop these other innovative activities. For instance, as Margarida said before, activities linking museums, activities that museums can bring to the day center, to the daycare centers, because of course we are used to do that as an education office. Specially designed activities, for instance, to engage the students, whatever. I think we have lots of new ideas coming up. And then to develop evaluation methodologies to the processes and activities for prescribing culture. For us, this is very important because it's the only way to be sure that we are doing the right thing at all dimensions when we are trying to perform any activity with someone, with the public. But in this case, we really need to develop these evaluation methodologies. We need to involve other institutions, university schools, of course, and department, but also other health providers or any other entity that really wants and can be essential to this project. And we have already booked an info day for the whole community, open to this whole opportunities of new partners for the 10th of September, again at 11 o'clock. We need to promote training.
Not September, December.
December, yes, it's well written, but badly spoken. Promote training in cultural prescribing. Of course, we all need very much training to have to be trained and to hear a lot from everyone that really knows about this. It's so great to have this opportunity of being discussing almost every week with Ruthanne and to talk with Cristiano, because they are really they are into this issue for some time now. And also to promote research, of course, about social prescribing in this heritage sector, and at last to promote cultural prescribing at the national, in Portugal, including Porto and Coimbra, in our PRISC infrastructure, for instance, and of course the international level, as we already started with the Edinburgh museums. So that's it. Thank you so much. And now I think we can really open this to discussion.
I think, wow, it was incredible the amount of information you managed to gather through study, through interaction with Ruthanne and our partners, but also from one experience with a volunteer. I think that was, it helps that you have training and sensitivity to these kind of issues, and that's why you're the leader, the PI of this project. So I think that for us museums, it is key to identify, we all do activities, hands-on, object stories, connecting the past and the present through our exhibitions and so on. I think the key in this particular project is really to differentiate, to identify what is different in the normal activities that we do with the general audience and with social prescribing. We need to start typifying this, like a bit like what Raquel did and Ruthanne, like the profile. Also, I remember one of the first things when I was with Cristiano, one of the things that he just, I said, I'm so excited, we're going to do this in the botanical garden. And Cristiano grabbed the paper and then he started writing and said, okay, so which are the activities? Okay, so, and I was like, what? Already? Yeah, okay. So you can, collect mood change plants from vases, you can contemplate, you can, and we started typifying. So I think that this is really what we need to do with our partners from the healthcare system to typify and identify what is really special and different that falls outside the scope of our expertise. And at the moment, I would not like personally to enlarge a lot the consortium. I think we're good. We're few. We're geographically confined to Lisbon. We have the help of the University of Edinburgh. So I would like really to go deep now, have more experiences, have pilot activities at the Museu de São Roque, at our museum and gardens, and then eventually enlarge to the community of museums in terms of awareness, enlarge to the community of researchers in terms of awareness, and later on do this, slowly and steadily and surely, because at the same time it's kind of frightening. I must confess, it's kind of frightening. We have to be very aware of our limits, and we have to be very humble at the same time as professionals, and be able to open up and share with others and learn from others, because we cannot do this. I mean, this is really the project. For example, it does not happen in other projects that we have at the museum, where we feel secure. We feel that we can, we're controlling the information, the circuits, and so on. We know where to go. We know the literature, and so on. In this project is really the project that I feel that we are most insecure, and at the same time more humble, but at the same time more excited, because it really forces us to work in collaboration. So at this point, I would like to open up to our colleagues at the museum. It's mostly for them that this session is done. Questions that you have, this is, comments, ideas, suggestions for any of the speakers, any of our partners, to Raquel, to me, whatever. Just share with us what is your view. Also, speakers are also welcome to speak, obviously. Ruthanne, please.
I was just going to pick up, Marta, and echo what you had said, both on the keeping it local before scaling up, mainly because I don't know if this is a situation in Lisbon and in Portugal, but certainly in the UK, because of COVID, the impact that COVID had on a lot of the organisations in the community that supplied social prescribing services, they are either completely gone forever now, or many of them haven't reopened yet. So on a local level, there is an absolute desperate need for people like ourselves at the university to be providing a social prescribing service. So it's the need to sort of look after the people at home, if you like, before expect. So I would completely agree with that. The other thing I was going to say was the difference for me between public programming and learning programs and the social prescribing is that with a very small letters, you could actually do harm. If you got the social prescribing wrong, you could do harm. Less likely to do that in the world of public programming or learning.
Exactly. And how can we minimize that? I mean, kind of have a system that monitors, permanently, so that we don't. Sometimes I have the feeling from my own experience that sometimes a sentence used wrongly, or a word even used wrongly, can set back the person, in terms of, I don't know what Cristiano thinks about it, but I mean, surely this is a huge responsibility to monitor and the company, right, Cristiano?
I think probably the biggest challenge are the patients somehow, because even though we have started many partnerships in the community with museums, not with museums only now, but with theaters, for example, and different activities outside the box, it's not easy to motivate people to go outside their comfort zone. And also because in Portugal there is not that kind of tradition, and probably the people being referred to social prescribing are the ones that are more vulnerable, low self-esteem, more depressed, so less willing to change behavior.
Yeah.
And certainly we need to work a lot on behavior change and finding new strategies to motivate people to be more active in the community and in the culture sector. And this needs as well a little bit of media, advertising, and a lot of people thinking in the same way. Right now, in Family Health Unit Baixa, you still feel that as not many people are speaking about it, people look at it with a lot of, they feel not sure, unsafe somehow, and because they are not used to be referred to community assets outside the health sector. So and as there is not a strong political view on it, and not locally and not even less nationally, people don't trust so much. So I think a key message is to promote this service and start to put it in local policies so that people trust it, okay, as an official service, that people involved are serious and they are really concerned about their well-being and health outcomes, and they don't want to push them to something that they don't want to do. They just want to provide them opportunities they wouldn't have if, for example, social prescribing wasn't there. So I'm sometimes afraid that the people that will accept this kind of activities in the community are the people that don't need it so much. So people already very active, already very engaged in the community, so that they are open to new experiences. And actually what you want is to reach the other people, the people who are outside the system. So we need to be very conscious about it, and find ways to not increase health inequalities and social inequalities with social prescribing.
That's right. And I think we're bridging more than one. We have more than one bridge here, because museums and theaters too, frankly, are elite institutions. Okay, they're elite institutions. So when you think of it from an health perspective, okay, you're bridging the cultural sector with the health. So your bridge, Cristiano. But at the same time, there is the bridge between the poor, the excluded, and cultural elitist institutions. There's that too, and that we deal every day, because we have it's structural, and so in fact we are using. I have to be very honest with all of you. We are using this project of social prescribing in order to reach communities that we would not normally reach. You know, so for us, it's a double objective: is to contribute, but also to reach out. You know, and even the word "reach out" is elitist in a way, because it means that we are here, you know, and we have things to say. It's actually working with the people, so we want to hear from them. We want them to change the way we work as a museum, our attitudes, our values, and our practices. So that's why this is really important for us. And it's a marathon. It's not a 100-meter race, you know. It's going to survive us. I'm going to retire as a museum director. Raquel will retire as museum director, Margarida, and so on. But this should continue structurally in museums, because we need to be more inclusive of everyone. So that's a very important point.
Marta, can I just add that for increasing confidence of people, I think it's really necessary to have this close contact with the health providers, being as the museums all the time. For me, it was really great to have Andrea with me and to call her or to just write to her. It must be like that, because otherwise people, they don't feel confident that I'm doing that with the health providers, of course.
No, there are barriers. There are barriers between people and museums, you know, especially the ones that are more marginalized and vulnerable. And between a university and the people who are marginalized, because it seems even more remote, it seems even more inaccessible, and I'm not allowed. It's a place I'm not allowed. So why should I go there? I think the garden helps. There's a difference between botanical gardens and, you know, the building, monolith, you know, buildings. So, and that's also a matter for research. It's an open question that we should investigate. More questions or comments or ideas on how to go forward?
I would suggest that it's truly important to integrate the university students in this pathway, because they will be the future professionals, the future generation. And maybe I'm one among a few that thinks in this way, but if we work well in the university, probably the next generation of health professionals will be kind of accepting this as a way forward, as a way to provide healthcare. And we need to do this. And very frequently also university students don't know the culture in the cities where they are studying for many reasons. Right. They are displaced, so they don't know the city. They don't have sometimes the money to engage in culture, and they are too busy and feeling too much pressure. Mainly medical students, feeling they don't have the time or the right to enjoy their life and engage in culture. So I think the Nova and the Lisbon University should play a big role on this, try to bring students to participate in culture activities, but as well to be volunteers, and maybe to provide them the chance to be a tutor or someone in the museum.
That's a very good idea.
I agree, Cristiano. At this semester, curiously, I feel students a little interested in the volunteering activities, because as they have a COVID-19 in this semester, they want to stay together and enjoy the student life. I think in the next semester could be different, but I totally agree with you, Cristiano.
Let's gather all the medical students. I don't know, is it better to catch them at the beginning or later? I don't know, we will have to think about, but let's gather them and do something with them. I think it's very important. Of course, you, Cristiano, as a medical student, when you were a medical student, you never heard about these things, right? You were not trained in these things. You search for the information after you became a doctor, right?
I didn't heard about social prescribing when I was a medical student. I think back then it was only starting in Bromley by Bow and something like this in UK. But I was engaging in culture. I was volunteering in many organizations. So probably I was already very sensitive to this. So that is not by chance that I'm here today. Anyway, a lot of medical students, I would say, they engage in volunteering projects, but maybe not with this long-term perspective. Okay, so they'll be more like focal initiatives, like and very medical, in a very medical way, like going to play in the toys hospital, like to help children to engage better with hospital staff, Hospital da Bonecada, with people like this, or going for a health fair in the central Portugal to take blood pressure and take the sugar levels, and maybe it would be more interesting for them to engage in volunteering activities that will train their empathy and open their horizons in a future professional life. So
absolutely.
But because courses are very demanding, especially at Nova,
sure.
And this difficult a little bit to make an option to do other things.
Yeah. They have their own mental issues and stress and anxieties, I suppose. But learn to deal with it. I mean, you're going to be a doctor. You have to learn to deal with it. And so the sooner the better. Ruthanne, please.
I put my hand up and now I've completely forgotten what I was going to say. It connected to the musicians. Yes, so we're the other thing we've done is reached out to the medical school here has medical musicians, so they've got a medical choir. So we've reached out to go, have you ever considered prescribing, in your future, thinking about you get so much out of music, have you ever considered that? So sort of working through the societies of the students as well as actually the colleges is another good way to go.
Fantastic. Well, we're reaching the end of our fantastic, brilliant session. I don't know if there are any more questions. I think we have a consensus that we probably will think about and develop an Erasmus project in order to facilitate connection between our institutions and go to the UK, meet some partners, engage with some of the, see firsthand the initiatives that are being done there, and the same for Ruthanne and colleagues. So I think that's going to be a very good thing. I was thinking that when Cristiano mentioned the media, I was thinking that maybe when we do an enlarged info day for the cultural sector and the healthcare sector, it would be nice to do some press conference, maybe in one of the partners, just say, hey, we're here and we want to do this, So maybe even in Baixa or Almirante, Reis, I don't know, or Santa Casa or at our museum, I don't know, but something physical, something present. I don't know if that's possible because COVID is getting worse. We'll see all that, but I think it's very important that we show ourselves to the media and raise awareness because that has implications in the, policies and so on. So we start, moving the field forward in a sense in Portugal, more in the position that it is in the UK, it seems. Margarida, you were going to say something? No? Okay. Okay, so I think, Raquel, anything else to remind us?
No.
No.
I think
okay, so
excuse me, only a thing. The info day will be 10 December in the morning.
11.
Same. It's kind of the same thing, but not for us, for healthcare workers and healthcare providers and university, the university and the museum sector. So I hope to have ICOM engage with us and disseminate this information through all museums in Portugal. So that's the target. Okay. We'll see. But it's going to be the same thing, the same kind of presentation, what we're going to do and so on.
Thank you.
I'm grateful to everyone who was here, first the speakers, also our colleagues from the museum, and finally our viewers on YouTube. And I hope that this was a useful session, highlighting, this fabulous project that we want to do together, that we're barely starting, but highly motivated. And I hope to see you